Welcome everybody to this week's Native Strong Town Hall. We have a lot to discuss today. Dr. Ignace wants to focus a lot on the Johnson & Johnson, the hold on the Johnson & Johnson vaccine. So we're going to get into that. For all of you who have joined us before, we of course welcome questions. If you're joining us via Zoom, you can jump in on the Zoom platform. There's a chat bubble on the bottom. Just click on that. You can enter a question there. If you're joining us via Facebook Live, streaming Facebook Live, you can just enter a comment there and we will moderate those throughout the session and answer those at the end in our Q&A. Per usual, our good friend Mark Denning is here to help us out, bring his voice from the community. With that, I'm going to pass it over to Mark Denning and get right in here. Thanks again for joining us.
Bueno, buju endo e maganaduk, nadawe benezi indigenous namendo dem, Anishinaabe and Dao, Neopodin Donjaba. Mark Denning, and welcome everybody, and it's good to be here. And I'm glad you're with us, either live or joining this on tape, as most people do. There's a lot going on, certainly with COVID-19, but for those of you that are with us, just a short review for those who have been with us for a while. If you move your cursor around your screen, what you'll see pop up, in mine at least on the bottom, it's a toolbar, and you'll see this little chat icon. And if you click on that, that's where you can ask some questions or clarifications. Perhaps there's something you've seen in the news or something you've heard from someone. I know some of my examples are going to be around sports. We're going to go back to coaching lacrosse in a few weeks, and with young people, and I do have some concerns and questions around that. Maybe not asked here, depending on how our forum goes, but they are there, and I want the players and their families to be safe. Second, just coming back from ceremonies in Crandon, Wisconsin, where all of those who were attending were wearing masks. Did most of our eating outside, and we socially distanced in a lodge-like setting. So it went very well. And I have to say that our community is a very, very generous community. This was given to me as one of the folks who spoke at that gathering, and it's got a sturgeon, my clan, on it, and some floral patterns on it. It's quite beautiful. And it's these smaller and larger things that we've been missing out on. And as we begin to move towards those things again, how do we do that carefully? How do we do that with responsibility? And how do we do that with others in mind? And that's why we're here to talk about this. Because as things begin to shift, in which direction are they shifting? I think there's good news and challenging news all at the same time. So thank you for being here. Please ask the questions that are important to you and your families. And Dr. Ignace, good to see you again. I understand this very busy day at the center. 500 or more inoculations going out today. Vaccinations going out today. And that can't be easy on a very small staff. So at least for me, who's getting vaccinations from the center here in Milwaukee, allowed me to attend ceremonies for the first time in over a year. Thank you. And more needs to be done. So Dr. Ignace, we'll go over to you, and thank you again, everyone, for being here.
Thanks, Mark, and thanks, Jeremiah, for allowing us to host this. So much has been going on the last couple of weeks. Pretty dramatic changes have occurred, and I know when I've been presenting, at least is to give you the latest information, so people can make informed decisions and get a better understanding of what's going on. And so there's been a lot of foundational blocks that have been put down and moving forward, and everything that gets presented gets presented on building on what has been talked about before. And so this is a pretty dynamic table of the current vaccines that are currently out there. So we have Pfizer, Moderna. We know about Johnson & Johnson, which has come up in the news, AstraZeneca, and Novavax. And so the first three have been approved for emergency use here in the United States. AstraZeneca, it has not, as well as Novavax has not either. So everyone has heard in the past, probably the last 72 hours, about Johnson & Johnson. What I'm going to present here is a little bit of some high-level information. I'm going to try to, bring this down as best I can to explain what's going on, at least what we know about right now, and what we know about some of the cases that have come up and some of the anatomical areas where this clot formation is developing. So just to kind of get people, at least foundationally, so here in the United States, as I mentioned, Pfizer, Moderna, Johnson & Johnson have approved. Pfizer's been out there, Moderna has been out there. And so this just gives you a quick glimpse of the Johnson & Johnson, how much has actually been ordered, how much has actually been administered to date. Almost 7 million doses of Johnson & Johnson have been given out. And as everyone is aware, what has it been? Yesterday, Tuesday, 2 days now, Johnson & Johnson, with recommendations by the FDA and CDC, is to place a hold on administering any Johnson & Johnson vaccine until further evaluation. And this is really based on the incidence of clot formations that have been reported. Now, what people may not understand or have gotten a full understanding of is this is a very similar process to what AstraZeneca vaccine and what occurred in Europe, what all of the commotion and all the issues around AstraZeneca in Europe now is here in the United States, and now is also part of that discussion as well. So everyone knows that AstraZeneca is not available here in the United States. Now, what has been interesting is that to date, as a result of AstraZeneca, they have found 220 individuals who've had these unusual clot formations, 220 out of 34 million doses that have been delivered in Europe. So Europe had gone through their motions to regulate and to identify this clotting, and what is now being kind of termed is VITT, or vaccine-induced immune thrombotic thrombocytopenia. It's a pretty big term for a disorder, or basically clot formation. So what is occurring is believed to be a rare problem. It is seen in other patients who've recovered from perhaps surgery or some other cancer or some autoimmune problem. And heparin, when clots form, heparin as an anti-coagulant therapy causes thrombocytopenia, and it actually can cause clot formation. That's kind of counterintuitive, but that is called heparin-induced thrombocytopenia, or otherwise known as HIT. Now, in all of these cases that have been shown, the immune system creates antibodies that activate platelets in the bloodstream. So the platelets, which normally promote wound healing, end up clumping and causing clots, and in this case are forming in the brain. So this autoimmune, this antibody process consumes platelets, clusters, clumps these together, causes blood clots, and this leads to a low platelet count, otherwise known as thrombocytopenia. So vaccine, AstraZeneca or Johnson & Johnson, induced immune thrombotic clot, thrombocytopenia, low platelet condition. So where are these clots forming? So that's what's kind of the interesting part here, because what is occurring is more than what normally would occur outside of vaccines, outside of COVID. This was a pretty rare condition, and I've only seen it twice in nearly 20 years of practicing. But in Europe and the UK, there had been events, clotting events, 15 events, DVTs, deep vein thrombosis. These are clots that form in the leg. 22 events involving pulmonary embolus, which means a clot that has moved from the lower extremities through the veins into the lungs, causing breathing problems, chest pains. So these were reports that had been ongoing as a result. Now, were they directly involved with the vaccine? I think the common theme for all of these was that under normal conditions, this was the only common denominator amongst all of them. But what is probably the most concerning is one particular blood clot formation, and this is in the Cerebral Venous Sinus Thrombosis, CVST, and you're going to be hearing more about this in the coming days, if not weeks. So this is a clot, a blood clot, a clumping of platelets that forms in the veins that drain the brain. Now, these certainly can be serious, and they can certainly be fatal. And a lot of what we're hearing about is this is occurring in younger people, less than the age of 55. And at least here in the United States, the cases have been reported in all females. So now what's unusual about this is that these clot formations are in the cavernous blood system of our brain. But what's odd about this situation is that the platelet count drops. Now, this all goes along with what I was saying before with vaccine-induced immune thrombocytopenia and the low blood count, clots and low blood count. So that's the unusual part, because that's normally not how this kind of phenomenon develops. So what I'm going to go through here is what's been going on, at least with the counterpart. AstraZeneca is a adenovirus vector vaccine. Johnson & Johnson is very similar. They use the same vector, same technology as AstraZeneca. So what was occurring in Europe, Germany had reported 31 of these CVSTs, these cavernous cerebral venous sinus thrombosis, that resulted in 9 deaths out of 2.7 million people who've been vaccinated. Same occurrence in the UK, 30 clots, thrombosis had occurred with these low platelet counts that resulted in 7 deaths out of 18 million people vaccinated. So based on the number of incidences with people who have gotten AstraZeneca, they've been estimated that nearly 1 in 100,000 people are at risk for getting this under the age of 60. So So that's going to be kind of a number that's going to stick out there moving forward. That's what Europe had resulted to. Understand that the European Medicine Agency, the EMA, is kind of equivalent to, in Europe, that's Europe, that's equivalent to very much like the CDC here in the United States, kind of a blend between the CDC and the FDA. The EMA is the equivalent over in Europe. So that was kind of their end metric of risk associated with AstraZeneca. Now, I know people have heard about the cases. There's been 6 cases, all are female, and the median age for this occurring was 33 years of age. So this is a profile of every single one of these patients, their initial features, and you see that there's a common cause here, and headaches is definitely one. That's kind of the initial feature that kind of persists. It gets worse, progressively gets worse and worse and worse and worse. That leads to nausea, vomiting, even fevers. But late features, now these headaches can progress, and they can progress depending on where these clots occur, and I'll show you the anatomy of that here in a second. But the clot formation and the location of it can be so severe, and the pressures become so high that it can start pushing on parts or areas of the brain that can result in confusion, can result in seizures, confusion, delirious, even paralysis, even one-sided paralysis. It can affect, based on location, it can affect vision, blurry vision. Now, if clots form in other parts of the body, it can cause pain in that particular area. So if a clot was to form in the leg, your leg would swell up and it would cause pain, some discomfort, and then progress to more and more pain. Just like if you were to get a clot in your abdomen, that pressure back up from the clot would cause discomfort and would progress the pain to severe pain and progress even more. So depending on where your clot formation is, that would kind of give an indication as to what is going on. But one of the interesting things, so I mentioned all 6, and there's a 7th case now that has yet to be delineated, but there is at least 6 documented. There is a 7th that just came out this morning. But each one of these individuals, all female, 33, average age of 33, only one person was on birth control, and none of these individuals had any pre-existing coagulation problem. So there weren't any indications to suggest a normal female that would lead to any indication that a particular person would be prone to getting this after getting J&J. So now this is the anatomical structure of and the venous structure of the brain. And so this is a 3-dimensional view of the big vein draining system of our brain. So there's one that goes right down the middle, that is called the sagittal. They have the frontal, the superior, inferior. You have the top part of the brain and the lower part, the inferior sagittal. So the one on top, one on the bottom. And then you have 2 that go off to the sides and then drain, collection and drain down and back to the heart. That's the transverse. And then you have, it goes to the internal jugulars and back to the heart. So, but these are big venous draining systems of our brain. And any part, any location of these areas can be thrombosed or develop a blood clot. And depending on where these clots are occurring, you could see where some individuals may have headache at the back, on the side, more in the front. It could be on both sides. It just really depends. But the most common symptoms, if there was to be a development of this, would be headache that would progress, blurry vision, fainting or loss of consciousness, loss of control over movement in any part of the body, seizures, and if severe enough, can lead to being unresponsive and into a coma. So the reason for these symptoms, as I've been mentioning, is there's an obstruction, a blockage, a clot, obstructing the flow of blood, leading to a backed up pressure. It's kind of like stepping on a hose. So when you're running water, you step on it, everything backs up. The same principle, just to put an analogy on this, occurs in the brain. That pressure can build and build and build, and that it definitely causes discomfort. It can cause progressive pain. Now, if the vessel can't manage that pressure, the vessel can start tearing and splitting and causing some bleeding. And that's where bleeding then can go into the brain and causing hemorrhage and bleeding. And that's where people start losing function and even consciousness. So, and that's a cerebral hemorrhage. Again, depending on where this occurs, if it occurs in the back of the head, that's where all of our neural function for sight occurs. Blurry vision can occur. If it occurs in any part of the brain in bleeding, it can cause fainting, loss of consciousness, and even seizures. Now, normally, aside from COVID, aside from all vaccines, this is such a rare condition, CSVT. 5 in 1 million people, that is kind of your risk of getting this, just normally. 5 in 1 million. It's not a whole lot. And so now we're talking about what's occurring now. We've had 7 million. Now there's been 7 million doses given. There's been a 7th case. So 1 in 1 million. So that is less frequent than what normally occurs. But there is, I think it's fair to say that there is an assumption right now that these clots are associated with the vaccine and should be until known otherwise. That's how this should be approached. This is how it should be figured out, that you assume that there's an association until it's proven otherwise. So now, as I mentioned, naturally occurring, this does occur outside. There have been cases that have been associated with vaccines even before COVID, before J&J. This phenomenon has been seen before. So in general, what I had just mentioned, normally, the background rate is about 2 to 5 per million. Now, so that should be the baseline to think moving forward, viewing what is occurring with Johnson & Johnson and the cases that we're seeing right now. That should be our baseline of what naturally would occur outside of COVID. So what's happened now, amidst of all of this uncertainty that's going on right now, the EMA, European Medical Agency, has kind of directed its official report that they are now ready to conclude that there is a link between the AstraZeneca vaccine and an increased risk of CVST in people under the age of 55. So if individuals weren't paying close attention to what was going on in Europe, this was a whole situation of what was going on with AstraZeneca, and why they put halts and pauses on delivering and administering AstraZeneca was this for this very reason. They were seeing this clot, they called it a rare clotting disorder. Well, what they were talking about was this CVST. They didn't really spell that out like this, but that's what Europe was going through. They paused, they went through all of their data, all their information from multiple countries in the EU bloc, and they now they're signaling that there is this link between the vaccine and this still a rare occurring event, but nonetheless, they are now giving out recommendations to not giving the vaccine for individuals less than the age of 55. Some countries are saying less than 50 now. What has occurred today is Denmark has suspended and removed all AstraZeneca vaccine from their vaccine program, and they're no longer will be delivering AstraZeneca as a vaccine. Now, I think people need to understand how important this is, not just here in the United States, but I think worldwide, is that the U.S. Johnson & Johnson pharmaceutical was intended on delivering 55 million doses of J&J to the European Union, which is a 27 country bloc in the second quarter. So that was between really now until June. They were planning on delivering 55 million. That was immediately halted as a result of the US, the FDA and the CDC recommending that there be a pause. So it's not just here in the United States as the impact has been felt, but it's going to be felt worldwide, especially in Europe. Now, one of the things I'll say about Europe right now is that there have been problems with the rollout of the vaccine. It's been clunky, it has not been smooth. There have been issues with AstraZeneca. There are other vaccines that we don't even would consider here in the United States. Other countries have developed vaccines, they're in the circulation. And so now there's pressure to demonstrate or certainly recommend what to do with Johnson & Johnson moving forward. And now that there's been such restrictions on AstraZeneca, it makes me hard to believe AstraZeneca will ask for emergency use authorization here in the United States if there is so much restriction on its utility. So that was a lot of information about Johnson & Johnson. Now, what you're also going to hear at the same time is, does the risk outweigh the benefit of using Johnson & Johnson? Now, the number of events that have occurred right now, 7 cases out of nearly almost 7 million doses been delivered. That's 1 in a million. That's not too far off from its normal occurrence. Does the risk of getting this disorder, blood clotting disorder, CVST, outweigh the benefit of what the vaccine has been clinically in the clinical trials shown to be effective in? Ultimately, Johnson & Johnson is effective and has shown to be 100% effective in preventing severe COVID and preventing hospitalization. That's a pretty significant benefit to the vaccine. So we've seen cases here, we've seen cases with AstraZeneca in Europe. Does the risk outweigh the benefit of utilizing Johnson & Johnson as part of our arsenal of vaccinating the country? So there's a pause right now. And so these are going to be the issues that are going to come out. And my sense right now is that we may very well be following what Europe had gone through and coming out with very similar kind of eligibility criteria of who would benefit and minimize an adverse event, such as these clotting issues with Johnson & Johnson. So that's what's out there right now. That's what you're going to be hearing in the next week. So I'm going to try to pull it back and let's talk about what's going on around here in Wisconsin. So I had presented with the ongoing COVID infections that are going on. What the state has recently done is they are randomly sampling and sequencing what type of positive COVID test. Is it the original virus? Is it one of the variant strains? And so they're sequencing and typing the variant that the positive tests are coming up with. And so as you can see, since a week ago, the most dramatic change is that the variant B1 427 and 429, the numbers for that variant have actually stopped rising. And what was more interesting was the variant B117, which is the UK variant, is actually, there were a lot more of that variant seen in the positive COVID testing that's occurring. So based on the region, here I show on the right-hand side which areas that have the predominant variant in that area, in that section. So you can see that it's really evenly split between the California variant and the UK variants throughout Wisconsin. The south central part is essentially even. But what I think is probably just as important to realize is last week, the California variant was the predominant variant, and that has now shifted from that to now the UK B117 variant. So of all of the COVID infections that are occurring right now, based on this table and the sequences that the state is doing, 94% of that is due to the original virus. 6% of that is due to variant causes, and then you see at the very bottom how this is all broken out. The P1, the Brazilian, California, the South African, and then the UK variant. So right now it is the UK variant that is the most predominant for the entire state. Now, when we start looking at how do we compare, how does the United States compare to other countries? And just to give a kind of a baseline view. So, you know, obviously we live here in the United States, we hear everything that is going on here, but what's going on in, let's say, India is a prime example, because they are another country, a much larger population than we are. And you can see the flow of cases that are occurring. Now, they had their initial surge probably early fall of last year, and then subsided and went way down while we were going up. Now we've gone down, and they are now accelerating so fast that I don't see an end to their surge. It may be a couple more weeks before they peak. And it's not as if that country, India, is not getting vaccine. They are. And in fact, they're actually getting and delivering AstraZeneca as their vaccine, believe it. So almost 1.4 billion people live in India. Last week I reported there was 150,000 cases a day. Now it's 180 cases. When you compare that to the United States, we've been hovering around 77, 75, 80,000 cases a day, but that really pales in comparison to what's occurring in India. That's probably the most comparable country to the United States that I can give you. You hear about other countries that are going through similar surges in cases. Brazil, we hear about Brazil in the news, and they've about 82,000 to 90,000 cases per day. We hear about France. In this past week, I don't know why there's these gaps between reporting. Like almost every third, every fourth day, they give out new numbers. So I'm not sure why that is, but it looks like the trend is based on what day, it seems to be on its fluctuating upwards. Now, two countries that I think are leading the world in its vaccine effort to vaccinate their population is Israel and the United Kingdom. Now, UK is touting that they have herd immunity. They've gotten to about 74% of their population has either gotten COVID or vaccinated. So they're claiming herd immunity threshold. And right now they're averaging about 2,400 cases a day. In Israel, it's kind of the same thing. They have vaccinated the vast majority of their population. And now their numbers continue to go down, 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 and they're averaging 175 cases a day right now, which is pretty minor if you ask me. So, two prime examples of how effective immunization vaccine program can be for their country if the country as a whole commits to getting vaccines. So, bringing that back here to Wisconsin, we see that as of yesterday, 38% of the state has received at least a single dose. We see the racial and ethnic profiles as well as the age demographic profile. What I want to draw your attention, obviously this is a native discussion here, so I'm going to focus on the native numbers here in Wisconsin. And this is the single dose, the aggregated single dose total on the left, and it's broken out by race. So we, at the top, American Indians, you can see the number of accumulated single doses been given out by individuals up until yesterday. Now that middle group, the highlighted yellow box, tells you the difference of new single doses given to that population. So as you can see, it goes right to left. February 24th, I've been tracking on a weekly basis, and you can see that the trend was going upwards up until about March 24th. Then it peaks, and then it starts to decline. Now, what I'm concerned about is that has the native population in the state of Wisconsin, that demand for the vaccine starts to dwindle, and I believe the answer is it is. Now, the rate of change on the far right, you see the rate of change in the past week goes by the increase in the percent of single doses on a weekly basis. So as you can see, as time goes by from March 3rd to up to April 14th, we see that rate of change dwindling downwards, continues to go down, down, down. Whereas if you look at the other racial and ethnic groups, you see that there is a peaking and increasing and a plateau, but a plateau that is continuing to be steady as opposed to declining like the native population here in Wisconsin. So that's why I'm saying that I'm concerned that that demand to get that demand for getting the vaccine is dwindling week by week. Now, this is the 25% of the state has received or fully vaccinated with their second shot. So again, you see that top row. That top row is the rate of the native population as it is going up. And on the right-hand side, going right to left, you see the rate change over the weeks. Now, there is going to be a delay in this table versus the previous table I just shown, because shots are given. If you got Moderna, 4 weeks, you get the second shot. With Pfizer, 3 weeks. So whatever we see today was the result of what the vaccines people got 3 or 4 weeks ago. So there is a bit of delay, and I think after this week, we're going to start to see that this percent change is going to start to plateau and then start going down. That coincides with the single dose. So that's what's going on with the native population here in Wisconsin. So what's going on with our vaccination program? There's now been 3.6 million doses that have been given. If you look at the bottom table, you see April 14th, and you see a number of 60,000. That's how many doses have been administered on the average every day. And so over time, you can just see this steady progression of vaccines being delivered throughout the state on the average. And we are now sitting at 60,000 doses per day. What's going on in the United States is, again, we see the progression. That red line is the 7-day moving average. So as of right now, 2.9 doses are being delivered on the average every day. And you see in the last week, there has been a plateau. So is this a sign of things to come? And it's quite possible that we may be reaching that point, that saturation point of demand meeting, the supply meeting the demand for getting vaccines. And so now we're at a steady state. And how long will this stay like this, or will we will we take another bump up, or will we starting to wane off here a little bit? That's hard to say. But we do have a plateau. And as we look forward here, we now have administered almost 200 million doses of vaccine. And we have 77 million people who are now fully vaccinated. The single dose thing of almost 124 million. So, like I mentioned, if we're plateauing here, there's gonna be a steady state for maybe another week or two. And then what happens? We may get close to 50% of the country that will get vaccinated. And what happens after that? It's going to be hard, because it's going to be an ongoing effort. We will probably continue to see COVID, and half of the country may not want to get the vaccine, and so we'll be stuck at this plateau and may not be able to reach that herd immunity threshold, that level that's been kind of this critical point of squashing this virus. So it's the rate of increase, it has slowed. Things are steady at a steady rate. The question is, how long will this occur? How long will there continue to be a demand for vaccine? I think early people, they've gotten it. Those people that bought into the idea of getting the vaccine and safety and prevention. We have those people that are on the fence. Are we going to get the individuals that have clearly said no way? And it's going to take time for those particular individuals to overcome that hesitancy to get their vaccine. So information about what is going on throughout the country. IHS, in the early beginning was doing exceedingly well. Vaccines have taken hold of many parts of Indian country, and the demand is starting to wane. In Wisconsin, as I mentioned, that steady state of increasing. Wisconsin's, their administrative rate is now at number 15, Minnesota 17. We hear about all of the activity of COVID infections going on in Michigan. They are slowly trending upwards now. So as we go more into what's occurring in Indian country with COVID, is as of April 13th, as we go down by area, we see the highlighted boxes indicating an increase in the number of cases from the week prior. And there's really no rhyme or reason as to why certain areas they do well, and then all of a sudden bing, in another place, and it pops up, and it feels like whack-a-mole every other week. But I guess the concerning part, when we look at it cumulatively, is that IHS is now reporting over 1,100 cases of COVID in the past week. The week prior was just over 1,000. 2 weeks ago, it was just under 700. So 11 straight weeks, we've seen the trend for COVID go down. However, in the last 2 weeks, the trend has now gone back up. Certainly not at the rate it did, last year increase, but nonetheless, it ticks up. And is it going to be, where is this number going to go? Is it going to continue to go back up? Is it going to stay this way? Is it just going to keep going, or is it going to turn around and start decreasing? Every week, some things you can kind of predict what will happen. Sometimes you can't. The introduction of all these vaccines that are going on throughout the country, and with IHS, tribes, and even us, it's just hard to say how this is all going to play out. What's going on in the Bemidji area, Michigan, Minnesota, Wisconsin, we see the number of new cases. In parentheses is the number of new cases in the past week. And we see that the rate of infection of COVID in Michigan is now at 6.3%, in Minnesota 6.8%, in Wisconsin 12.5% of the native population has now gotten COVID. So, the numbers, you can kind of see where the numbers are, what state is kind of leading in cases, who is kind of trending. We're trending back upwards now. We were down to 1 case 1 week, and now we've seen 55 cases in the past week. So looking at how vaccines have been delivered to our area. So Bemidji, Michigan, Minnesota, Wisconsin, almost 140 doses have been delivered. Almost 95,000 have been administered. And the percent of those distributed, 68% have actually been given out. So as a comparison, looking at other areas of the country, Bemidji sits there at number 5. So that is actually a pretty good rate of delivering vaccines to people. Now, I know I've mentioned at least twice, several weeks now, that we've hosted 2 vaccine events. One that involved Moderna, the second one that involved Pfizer. Now, as you go look at this, you see that there are lines. I have the different shades of color here. I want you to look at the yellow line, that is the American Indian Alaskan Native line. And this goes back to when doses first were introduced to the community, to the state. And racial and ethnic data was tracked for everybody. So we see this is the rate per 100,000 by race in Milwaukee County. And so as you go from December all the way up until January, March, you see that there is that spike, that yellow line spikes the week of March 7th. Well, that was the week that we hosted the Moderna vaccine. And we delivered 460 doses to Native individuals and throughout the Milwaukee County area. So we had actually increased that first dose rate by almost 350% in 1 week. So you see that that's a pretty significant rate of vaccination for Milwaukee County. And then the following week, we took a break and it went down. That following week, we did another event, and that was with Pfizer. And you can see that, again, that spike goes up again. And so that was our contribution, 2-week contribution to assuring natives in Milwaukee get a vaccine. So this was kind of that direct line of evidence showing the effectiveness of our vaccine campaign to get people shots. So this is another display, and this is data from the Office of Emergency Management, OEM, that operates out of Milwaukee County. So they've been gracious enough to give us this information. But again, this is looking at Milwaukee County only, again, who've received at least 1 dose. And we're looking at 30% of natives in Milwaukee County have now received at least 1 dose. This is kind of a line that you would not normally anticipate or expect to see, but that's a pretty good effort and percentage of Milwaukee County natives who have gotten the vaccine. And you can see how the other race and ethnic groups kind of play out here. So this is, I think, people who've gotten, natives who've gotten vaccines here in Milwaukee County, I think should be a part of this contribution here, and that's important. And everyone should be happy to see that natives in Milwaukee County are getting vaccines. Now, unfortunately, what's going on, and we all know this, we've seen it, is what's going on in Wisconsin is that 7-day average is slowly kind of creeping up, 823. Now, as a comparison, almost a year ago, we've been kind of dabbling in these same number areas. As of July 17th of last year, we were averaging 822 COVID infections, and so things are continuing to be the same. Third in infections, second in hospitalizations, first in fatality rates, and this has been pretty steady and has been ongoing for several months now, has not changed. So what I'll do now is kind of give this back to Mark and Jeremiah. I know this is a lot of information that I give out, especially on J&J, but certainly willing to engage in any discussion.
Okay, thank you, Dr. Ignace. So this question comes from someone who's worked through the duration, fortunate enough to have a job through the duration of COVID-19, kind of seen the ups and downs. So kind of a down piece right now is this, I don't know how to say it, it's anecdotal, it's not like research that you're presenting, but just within their workplace, there is a reemergence of not the COVID-19 virus, but like just having a cold. Mm-hmm. And when it hits really big. And the first thing employers do is say, here's your COVID-19 test. This is an hourly employee.
Yeah.
Now they can't go back to work. They got to wait a day or two for the results. And even when they do, there seems to be something else going on out there. And so what I'm not wanting to jump ahead of things, but what I'm saying is this is concerning to people who don't watch our program or know a lot about COVID-19. But could you explain, is there a reemergence of cold and flu virus going on right now? Because from a native to native conversation, this is concerning by people who are working, not watching the news. They're seeing a reemergence of people getting sick, getting put off of work. And I'm hoping you can address that concern.
Sure.
If you can help explain that to people.
Yeah, so, I mean, this is certainly an individual's observation, and it certainly has been mine as well, that, you know, we're at that tail end of the cold and flu season. If people do get run around and get sniffles and maybe a sneeze or a cough, you know, right now, my general sense would be that it probably is some kind of common cold virus. Certainly is not the flu, but it's a common cold virus. Now, the dilemma here is because we're still in the pandemic, is we all know this, anybody who gets cold-like symptoms, a concern first and in the forefront of everyone's mind is this COVID, and unfortunately, you'll need to get tested and you'll need to go through the whole 9 yards like we done over a year ago. And the same thing, this is just a continual reminder of how this is just hanging around. Now, that's the unfortunate thing, but yes, we're at the very tail end of the cold and flu season. So we also have to remember what we had just gone through too, is we just had Easter and spring break. And so people had been congregating, getting together, having social interactions. And so, you know, the common cold is still kind of a contagious virus, and it's still present, and it always is present. I think early on that I had discussed that, you know, there's probably over 150 different types of viruses that can cause common colds. And here we're trying to focus on one particular coronavirus, SARS-2, when we know there's many more viruses out there that can cause the common cold. So it's quite evident that it's present, and we still have to, just a sharp reminder that we still have to maintain our duties.
We have just about a minute left here, ending at 4 o'clock. I know it's a busy day, so this is I've met with some coaches that are coaching youth lacrosse. A lot of teams in the Milwaukee area are back to practices because school is back in session, either limited or back to full time. So what I've run into is, of course, the coaches that wear the masks around their nose, or because they're outside, they don't have to wear anything. And what I got was a coach tell me that, well, because kids are wearing this kind of helmet, that's protection enough. And that because they're playing lacrosse, and they're not talking about traditional lacrosse, but game lacrosse is about 3 feet in length, that this helmet and this is going to give them protection. So this is for all you parents out there that watch this and are concerned about playing lacrosse this spring. What's your recommendation for kids that are using this kind of stuff?
Yeah.
And running into people saying, you'll be just fine out there, kid, go out there and do your best?
You know, it's kind of an interesting dilemma, I guess, since, you know, spring is here, summer's coming, people are going to be more and more outdoors. And we just all know the common sense approach here is that the more likely you're going to get get COVID is from being indoors in a closed area for prolonged periods of time versus being outside. And so the interaction between individuals on a field, whether it be soccer, baseball, lacrosse, football, your interactions and sharing a space becomes, well, it's more, there's no well-defined space that says, this air is good and that air is not good kind of thing. But remember, being exposed to COVID isn't just a split-second exposure. It is a prolonged exposure in a confined space for a period of time. And so being outdoors, you do have a sense of more liberties in being outdoors. Now, does that mean you have to be fully masked? I think to say that the helmet that you showed would give anybody any protection is, I think they should just not say that part. Just no. It's pretty much saying wearing nothing. But it'd be interesting to see what the league recommends for players. Now, minors, when it comes to 18 and younger, obviously there will be more control, and they may suggest some type of covering. It may not be a mask, but some type of covering, whether that be one of them gaiters, neck gaiters, or even handkerchiefs, or some type of covering over with their mask. That would be a lot easier to breathe through than one of these kinds of masks. But I know my daughter, she plays soccer. Even outdoors, they recommend that they have the mask. So, but there are certainly more liberties that people can take that wouldn't be so restrictive versus being indoors. I can't give you a hard answer, only because I don't know what your governing body of the sports of lacrosse actually recommends teams to do it. But don't tell me that helmet is protection, because it's not.
I just wanted to clarify that, and I want to be able to quote Dr. Ignace out on a field and the flag's getting thrown, and they're playing some kid, and they're actually 16 in a 12-year-old league, and hey, that kid's not wearing a mask, and that's my only way to get him off the field,
Yeah.
So all kidding aside, it is an issue. It's a concern for parents. Face covering is recommended.
Mm-hmm.
So that's what we're going to do. What that looks like, I know the mask you held up, it's right now, what we got is kids that sweat into them and they get heavy. And it's not just breathing in the material, it's actually it's just almost unbreathable once it gets wet and it's on there for a period of time, because they're playing continuously like soccer, but the weather's been pretty good so far. So thank you for the answer. I appreciate it. You cleared it up for someone out there in the league. And you have the last words for our day and visit. And we're looking forward to more of those numbers, to seeing if any of this is making an impact in our community. So Dr. Ignace, thank you. And the last words for our visit today.
Yeah, so Johnson & Johnson, AstraZeneca, they're going to get a bad rap, even when we know the benefit of the vaccines are going to outweigh the risk, without a doubt. Its effectiveness is really good, and just as good as Moderna and Pfizer. I'm sure the FDA and the CDC are going to come out with their own recommendation and their guidance on how to manage this, but at the same time, I think I think ultimately the discussions will be around the risk outweigh the benefit, and this is going to come up continually. That's what happened in Europe. I suspect that will continue to follow here in the United States, and there will be some guidance as to how to utilize Johnson & Johnson. So now, with regards to Pfizer and Moderna, there have been no associated adverse events of clotting problems with those vaccines. And if you are still one of those individuals that have not gotten the vaccine and you're still on the fence, every person has a part in assuring that we keep our communities and our families healthy and safe. So there may be a day that you're going to get a call. Please take it, because it may say we have vaccine available for you. Opportunity is there. I would not worry. We all have had some side effects related to vaccines, but that should not be a deterrent or lead you to hesitancy to get the vaccine. These side effects are minimal and minor and last for a day or two, and they go away. So, 2 days of side effects to the possibility of preventing you or a family member from becoming gravely ill, I think it's a small effort to take on, to be responsible for yourself. So I'll have more information about the vaccine next week. I'll update, provide information on all the numbers. So until next time, everyone stay strong.